All right, future physicians, welcome. Today, we're going to dive into something that's way beyond what you'll find in textbooks or lab reports. We are talking about the very heart and soul of your profession, medical ethics and professionalism. Look, this isn't just another subject to pass. This is the bedrock, the foundation on which you are going to build your entire career. And, more importantly, the trust of every single patient you meet. So let's get into it.
At its core, medicine is just a profoundly human thing. It's not really about just treating a disease, it's always about caring for a person. I think this slide says it all, right? The real magic, the true art of healing, it's in that connection, the compassion, and the commitment you show to another human being when they're at their most vulnerable.
So why all this new focus? Well, for years, medical school was fantastic at teaching knowledge. That's the cognitive stuff, the what you know. But there was a piece missing. What about the canative domain? Just think of it like the doing part of your brain. It's what actually drives you to act, it's your motivation, your will. As Dr. Metha points out here, AETCOM was created to give some real structure to this absolutely crucial but often kind of overlooked part of becoming a doctor. It's a huge shift towards building not just smart clinicians, but truly compassionate professionals.
Okay, so to get our heads around this, we've broken this down into 5 parts. We'll start with what's officially expected of you as an Indian medical graduate. Then we'll get into the 4 core principles of ethics. We'll see how those ideas look in the real world as professional behavior, apply them to a tricky dilemma, and then we'll wrap up with the big challenge that all of you are facing.
So, first things first, let's be really clear about the goal here. The system isn't just trying to turn you into a walking, talking medical textbook. Nope, it has a very specific vision for the kind of doctor you're meant to become.
So this is it, the Indian Medical Graduate, or IMG. It's defined by these 5 roles. And yeah, of course, being a brilliant clinician is number 1. But you're also expected to be a leader, a clear communicator, someone who never ever stops learning, and most importantly, a true professional who lives and breathes the highest ethical standards.
I love this slide because it shows you exactly what we're talking about. Look, everyone who gets into medical school has the brains for knowledge and skills. That's the left side of the chart. That's your ticket to the game. But what separates a good doctor from a great one? It's everything on the right side. It's your attitude, your values, how you respond to people, how you communicate. That is the AETCOM domain, and that is where trust is born. So how do we actually build that foundation of trust? Well, it all starts with understanding the 4 pillars of medical ethics. These are the supports for every single decision you are ever going to make.
First up, autonomy. This one is huge. It means your patient is the boss of their own body, period. Your job is to give them the information, lay out the options, but that final decision, it always belongs to them. It's all about respecting their right to choose their own path.
Second, we have beneficence. This is the active part, right? This is your drive. It's that constant commitment to do good for your patient, to always act in a way that helps them. So it's not just about knowing all the treatments, it's about recommending the one that's going to best help this specific person in front of you.
Third is non-maleficence. This one goes hand in hand with beneficence, and it's probably the most famous medical principle out there, primum non nocere. First, do no harm. It just means that before you do anything, you have to weigh the risks and make absolutely sure you're not causing more harm than good.
And finally, we have justice. Now this one's kind of like a two-sided coin. On one side, in your clinic, it means you treat every single patient fairly, no matter who they are or how much money they have. But on the other, bigger side, it's about the fair distribution of healthcare resources across all of society. It reminds us that we have a duty not just to our patient, but to our whole community.
Okay, so here's where it gets really tricky. In a perfect world, these 4 principles would all just line up nicely. But we don't live in a perfect world, do we? In reality, they crash into each other all the time. What do you do when a patient's autonomous choice, say refusing a treatment that could save their life, is in direct opposition to your duty of beneficence to help them? This is exactly where being a good doctor becomes an art.
Which brings us right to our next section. Okay, so knowing the principles is one thing, but actually living them, that's something else entirely. Let's talk about how these big ideas translate into the day-to-day actions we call professionalism.
Professionalism isn't some vague idea. It's made up of real, concrete actions that build that trust we keep talking about. It's being honest, even when you've made a mistake. It's being totally committed to your patients, putting them first. It means you never stop learning, and you understand your responsibility to society as a whole. And, so importantly, it's about respecting boundaries.
The doctor-patient relationship is built on this incredible, almost sacred level of trust.
and professional boundaries are the guardrails that keep that trust safe. This means keeping patient information confidential, no matter what. It means never taking advantage of your position, and, in today's world, it really means being incredibly careful about how you present yourself on social media. All right, let's put all this theory into practice. We've talked about the principles and the behaviors. Now let's see how they actually play out when things get real, specifically with informed consent and tough ethical dilemmas. So, informed consent, what is it really? It's the principle of autonomy in action. And the most important thing to get is that it is a process. It is not a signature on a form. It's a conversation. It's you making sure your patient genuinely understands what's going on, what their options are, the risks, the benefits, so they can make a choice that is truly right for them.
Okay, let's get into a real scenario, one right from the AETCOM module. Picture this. You have a patient, Mrs. Lakshmi Srinivasan. Her biopsy results just came back, and the news is not good. She has lymphoma.
Now, before you even get a chance to talk to her, her husband pulls you aside. He's panicking. He says, "My wife can't handle that diagnosis. I want you to tell my wife that she had TB." He's asking you to lie, to protect her from what he thinks will be completely devastating news. So just pause for a second and really think about this. As her doctor, which of those 4 pillars we just talked about are now at war with each other in this one moment? What's your gut telling you to do, and what principles are driving that feeling?
This just perfectly shows how complicated this gets. On one hand, you have the patient's autonomy, her absolute right to know what is happening in her own body. But on the other, the husband's request pulls at your duty of non-maleficence, to do no harm, and that includes emotional harm. Your primary duty is to your patient, not her family, and you know that whatever you do next is going to massively impact their trust in you. There's just no easy, simple answer here.
And honestly, this is the most important lesson of all. AETCOM is not a rulebook. It doesn't have a list of answers in the back. What it does give you is a mental framework. It gives you a way to analyze a tough situation, to weigh those competing principles, think about the consequences, and then finally make a decision that you can stand by and that you can justify.
And that brings us to our final and probably most important part of this whole discussion, the real challenge that is right in front of you. Not just for the next few years of medical school, but for your entire life as a doctor.
Look, anyone can memorize facts from a book. Anyone can learn a procedure. That knowledge, yes, it will make you a medical practitioner, but it will not, on its own, make you a trusted physician. The answer to that question, it lies in everything we've just talked about. Your commitment to these ethical principles, your professionalism, your empathy, your ability to communicate with another human being. That is what will earn you the trust of your patients, and that is what will define the kind of doctor you become.